Everybody knows the southern U.S. Mexican border is wide open, but what you probably don't know is massive numbers of illegal immigrants are bringing in malaria and tuberculosis unfettered and resistant to antibiotics. Claire Lopez, the U.S. border with Mexico has gone into chaos, the likes of which has never been seen. Title 42 is gone. It's replaced with Title 8. Claire, can you explain the difference between these two federal mandates? And then we're going to talk about the diseases pouring across the border.
Well, back a couple of weeks on May 11, something called Title 42 expired. That was a measure policy during the Trump administration that helped CBP, Customs and Border Protection, to turn back illegals at the border and expel them. Supposed to be replaced by Title 8, which is about immigration law, and it refers to how the United States, by law, deals with those who want to claim asylum in this country.
42 is gone and 8 is in place, but
yes,
we're not enforcing the laws, Claire.
No. Now there apparently has been a slight decrease in the illegals crossing the border in these last couple of weeks, but that may be just due to uncertainty as to how Title 8, this asylum request law, would be enforced.
Well, you brought something to my attention which our viewers really need to get. There are massive, untold numbers of people infected with highly contagious diseases pouring across the border. I mean, they're talking about malaria has devastated Panama because immigrants are coming north from South America and infecting the country. There's busloads of people infected with active tuberculosis. They're being allowed to travel north to the United States. They're talking about villages where they're in Panama in specifics that have malaria and tuberculosis infections that are now drug resistant, right? And yet they're pouring across the border with infectious diseases, the likes of which in numbers have never been seen in this country. Claire, how bad is it? And why are we letting everybody in that's sick?
It's very bad, and it's going to get worse. These are diseases, as you say, Barry, that have been either eradicated in the United States long time since, or we just have not had them prevalent in the United States before. And if Title 42, which was a coronavirus era measure implemented by the Trump administration, would serve to test and to keep out those with active disease, why can't Title 42 be applied now when we're facing all of these diseases, as you've just mentioned?
Has anybody on the federal level explained what the heck they're thinking to let people in? This isn't the flu. This is tuberculosis, for God's sakes, and malaria.
Yeah, antibiotic resistant tuberculosis, malaria, scabies, but nobody's being tested. That's the thing. Nobody's being tested for any of this. And our health systems around the country, find out when these people arrive in their community carrying these diseases, and they show up at, healthcare facilities.
Despicable and frightening. And it's a real threat to national security, which is why we're talking about it.